Our health director will be here as well. I want to just start off by saying that here in Long Beach we believe that housing is a human right and that every person in our city deserves access to safe and secure housing. We're committed to ending homelessness, and our outreach and housing efforts in the last year have reflected that. In fact, this city for the last decade has been deeply involved in the work of ensuring that we house as many folks as possible, and that in the middle of this homelessness crisis, which not just we're in, but the state, that we continue to do as much as possible. We also know that within the next week or so, not just Long Beach, but large cities across the state of California will be releasing their numbers as it relates to our homelessness count. Those are an important metric, particularly during the pandemic, of how cities are doing. And then certainly we know that we expect homelessness not just here, but across the state to increase. I also just can't overstate how much impact there has been because of the pandemic due to people that are unhoused. We all know, seen enormous impacts on mental health, on people being able to actually access housing, on people being able to afford their rents or stay in their homes. So these are all things that impact homelessness. But we are especially excited in Long Beach to begin starting to shift the way we respond to people experiencing homelessness. And the REACH teams that are here, some of the vans behind us, are a big part of that. The REACH van you see behind me, and then the new van, of which will also get wrapped here in just the next couple of weeks, are new ways that we respond now to people that are experiencing homelessness and that are having mental health challenges or a mental health emergency. In the past, when we've had mental health issues or emergencies, oftentimes it has been police or fire that have had to respond to these instances. We've relied on, of course, community partners, and oftentimes, when possible, our health team would do this work as well. But this model really shifts the ability for us to go out and send direct assistance to unhoused folks that are having serious mental health issues or emergencies. We know that these teams back here are not only going to have the resources that people need to stay safe and healthy, but each one of these REACH teams will have one clinician, one nurse, and one outreach worker. And all of these workers, these teams of three, will all be well trained on how to deal with, react, assist, and help people that are unhoused and having or suffering from mental illness. I also want to note that we are beginning this shift away also on the way we respond. And so we know that while we have 2 teams now, and we hope to expand that to hopefully 3 teams or 4 teams here in the future, we know that this response is going to make a big impact across the city. And I'll give you just one example. We know that now, if we know there is a person that is unhoused, perhaps at an encampment, perhaps having serious issues across our city, instead of having a police officer or even a firefighter come to assist that person or help them try to get into housing, we can now have a dedicated outreach van and one of our REACH teams go out and work with that person directly, knowing also that these vans have the medical needs and the medical equipment to help them on the spot if they're actually having a medical emergency or a real important need that needs to be addressed on the spot. I can't tell you how important it is to begin this shift so that we are always responding first with people that are trained clinicians and outreach workers. And so this is a larger part of what we're doing in the city to shift this. And a big part of this will also be tied in and see the diversion that happens when folks call 911 for emergencies. Well, that is still being rolled out, as we all know we've been talking about over this last year. If there is an emergency when someone calls 911, and if there is availability, instead of that diversion going to police, one of these outreach teams, one of our REACH teams, will be able to go instead and actually help and assist someone instead of a police officer on the spot. And that is something that I'm really proud of today here in Long Beach, that we have made this transition and this switch. And I especially want to thank all of our health department team, our homeless services team that have been such a big part of what we're doing here today. And so with that, I want to turn this over to Kelly Colopy, our health director. who's going to give some more updates on how we're doing and answer any questions as well about the REACH teams. Kelly.
Good afternoon, everybody. We wouldn't have REACH teams and outreach teams without our people. So I wanted to just let you all know that these are many of our outreach teams, our REACH team members, and those who are out on the streets every day connecting with people experiencing homelessness within our city. So I just wanted to highlight for you what a fabulous team they are. So thank you, Mayor. As the Mayor said, we are addressing the basic need for care, treatment, and housing for residents who are unhoused in Long Beach. REACH is an innovative and best practice model for integrated health and mental health outreach. Often people receiving follow-up services from our REACH team have been underserved by traditional care systems. They have complex care needs along with histories of trauma. So the REACH team, while going out to visit with them, also works very closely with partners, organizations, community-based organizations, and treatment protocols to be able to really connect and work and make sure that they have the services that they need. The REACH team provides an alternative response that focuses on connecting people to mental health and physical health services, as well as housing and case management resources. As the Mayor mentioned, each team has a public health nurse, a mental health clinician, and outreach workers. So last year, we responded to 567 requests for outreach and engaged with more than 1,800 people. Each member of the REACH team received extensive training in supporting people through experiences of trauma, educating people on health and medical conditions, engaging people in conversations about substance use with a focus on both harm reduction and behavior change. And these unique skills have equipped the teams with the support and tools to guide people experiencing homelessness into interim and permanent housing solutions. The REACH teams also conduct neighborhood needs assessments to identify the areas that have historically been underserved by health and housing resources. This approach allows for the proactive outreach, follow-up, engagement, and interaction with those in treatment settings such as in hospitals, mental health and substance use disorder programs, and interim housing situations. The team has worked hard to ensure they maintain connection and people are continually supported in their recovery. The REACH team has successfully supported in getting some of the most vulnerable community members off our street. People with over 20 years of unsheltered homelessness, people with mental health issues that have impacted their ability to provide basic care for themselves, people who are regularly using fentanyl and high risk for overdose, and people who are directly experiencing human trafficking. Currently, the Long Beach Emergency Communications Center assesses all incoming calls for 911 to the emergency lines and determines the most appropriate response. Some calls requesting services for people experiencing homelessness do not require law enforcement or emergency medical response. From 2018 to 2020, 911 and the non-emergency line received nearly 12,000 calls to respond to homeless encampments. 96% of these calls resulted in non-criminal outcomes and were coded as advised, assisted citizen, gone on arrival, or checked okay. The REACH teams have provided an alternative option that reduces impacts to the city's emergency response system for calls about encampments while we work to address the root causes of homelessness. We know that the pathway to homelessness looks different for each person. COVID-19 has exacerbated economic, health, mental health, substance misuse, and other conditions which have had a larger impact on our residents who are unhoused, calling for innovative and coordinated responses. The REACH teams are a key component in addressing these conditions and ending the cycle of homelessness for many through proactive follow-up, engagement, and close coordination between the health department and our other care partners. It's going to take a continued commitment and a willingness to think big to ensure improved health and quality of life for our unhoused communities. The REACH team demonstrates that willingness. It will take all of us to end the crisis in homelessness in our city, and the community, you as community members, can also join in playing a role. I apologize, it's very windy out here. There is one area that I do want to call out that's beyond the REACH team for people to start to think about. We are seeking landlords to take vouchers landlords with housing units. We have nearly 400 people experiencing homelessness with city vouchers, with housing vouchers, who are seeking units in the city. We also have another 100 who have housing choice vouchers that are at risk of homelessness. Those with vouchers receive case management and other services while they are in housing. We have landlord incentives to make it easier. We encourage you to be part of the solution. If you are a landlord, please help and call the Housing Authority and sign up to participate. You can make a very big difference as these people have the opportunity to be permanently housed with your support. Thank you, and with that, we're open for questions. Yeah. Hey, Jason.
When you said you guys responded to 567 calls for the last year, is that from, I think the program launched in August, right?
Yes, I believe.
So are you saying like from August to December or from August to now?
No, till now. Yeah.
How many of those calls resulted in people accepting services and coming off the street?
We had 87 people who engaged in ongoing supports and efforts with us in that space around mental health and health.
I think when the city originally announced the program, and I don't know if this has changed, but I think there was supposed to be 4 people per team. Are there still 4 people per each team, or was it reduced?
There are 2 outreach workers. I apologize. Yeah.
All right. Aside from the vouchers that are being, that these people have to potentially help them get permanent housing, what other kind of incentives exist for landlords to accept them and be part of the solution?
Well, this time, really what we're trying to do is make sure that there's affordable units, right? And so the Housing Authority vouchers are, they're guaranteed payment. They've come with supportive services, and people are already matched with their vouchers, so they're ready to go. So when that is a key piece for us, I think ongoing, affordable housing and housing for low-income residents and community members is important. No, I think we're hoping, within the next year or so that can happen. What's that?
I think we're also hoping that in this year's budget cycle that we'll be able to actually do that. So I think there's an expectation and the council's talked about it, and I think I'm certainly interested if we're able to increase the REACH team and add an additional unit or at least 1 or 2, that would be great. Sure.
Did the team ever expand to weekend hours? I know that was kind of contingent on the budget when the program was first announced.
They have not expanded at this time. Additional team would allow for that.
Yeah, if we added 1 more team, that would actually help cover the weekend issue, which is something that we're looking at right now. I think that's it, so thank you very much.